Performing really well during your clinical rotations is very critical, not only to pass the courses, but also to show how well you're going to practice as a clinician to your preceptors and clinical sites, because they might be able to help you to get your first nurse practitioner job. There are some common mistakes nurse practitioner students make during their clinical rotations that might lead to unfavorable impression on their preceptors. In this episode, I'm going to talk about 5 common mistakes nurse practitioner students make during their clinical rotations. Let's dive in. Hi, I'm Miki Miura. I'm a family nurse practitioner in Hawaii. I've been practicing as a nurse practitioner for 10 years, and I precept nurse practitioner students. In this episode, I'm going to teach you 5 common mistakes nurse practitioner students tend to make during their clinical rotation based on my personal experience as a former student and also a preceptor. First common mistake nurse practitioner students tend to make is create your own acronym. In the medical or healthcare field, we're moving away from using acronyms because sometimes that leads to mistakes, but we still use some acronyms. Now, the most important thing is to convey accurate message to other healthcare professionals so we can provide safe care to our patients. So using acronym correctly is extremely important. I've seen some nurse practitioner students and even practicing nurse practitioners use acronyms that nobody else used, but they created their own just because it sounded okay. But that can lead to confusion and mistakes. So I will definitely recommend against creating your own acronym. When you read other providers' notes, you might notice that we use certain common acronyms. Like in women's health field, we use WWE or WWV, which stands for What Woman Exam or What Woman Visit. If those acronyms are used commonly, it is okay to use, although you might want to be safer and just spell out everything, but try not to create your own acronym and nobody else understand what you're saying. Second common mistake nurse practitioner students may make is to completely copy and paste other providers' notes. Preceptors are evaluating your ability to come up with accurate diagnosis and also come up with treatment plans. So we are looking into your thought process. We can totally tell whether you copy and paste. In the past, I noticed my student completely copy and paste my note. I realized this sounds like me. And I look back my previous note and it was completely me. She unfortunately copied and pasted my note. Although I tell my students to read other providers' notes and learn how they are expressing certain things, I love reading other providers' notes, especially when I refer to other providers or even collaborating physicians, so I can learn how to express things more accurately, more efficiently. For example, when I'm looking at hematologist notes, I can see, oh, he's describing this condition this way, or he's wording this way beautifully, so I'm gonna try to learn from that. So learn from other people's notes. You can learn phrases or certain terms and stuff like that, but you don't want to copy and paste the whole note or even a whole paragraph, especially if you are a student. A preceptor is looking into see your ability to create a note, come up with the plan and express your plan in an accurate and efficient way. Copy and pasting other providers' note completely will make you look like you are lazy. I would avoid doing that. I hope you are enjoying this episode. Before we go back, I want to quickly mention that I'm giving a gift to you for listening to this episode. I'm giving a free PDF nurse practitioner job interview prep checklist. This checklist is full of questions that you're likely to be asked during job interviews as a nurse practitioner and some tips on how to prepare for them. With this downloadable PDF, You can prepare for interviews so you feel confident and stand out from other candidates to get the job that you really want. To get this free PDF nurse practitioner job interview prep checklist, you can go to usa.jnpproject.com/interview. Again, usa.jnpproject.com/interview. Now, let's get back to the episode. Another common mistake nurse practitioner student may make is to perform invasive procedures without your preceptor's permission, especially certain procedures like neck balloon implantation, which is a birth control implant, shouldn't be done by uncertified providers. So if you are nurse practitioner students, you shouldn't perform neck balloon insertion procedure yet. Once you get licensed, then you get certified, then you can perform neck balloon insertion. But until then, you can observe, but you shouldn't actually participate in. And worse than that is you do it before letting your preceptors know, so your preceptor don't have time to mention, hey, you shouldn't do that as a student. You cannot participate in that yet. If you are in question, like, should I do this yet? It's always a good idea to ask your preceptor, hey, is it okay if I do this on my own, or should I wait for you? Fourth common mistake nurse practitioner students tend to make is not recording important things for your clinical record. Different schools have different requirements, and you need to record different information like the age of patients that you saw, diagnosis of the cases you saw, and so on. You need to make a note. As a preceptor, I don't remember which patients are seen by my students a week ago, a month ago, a few months ago. And there was a case that my student forgot to take a note, and after she finished the rotation, she asked me if I can fax the progress note of my patients. And of course, I said, no, I cannot do that, unfortunately, because it's a HIPAA violation. I need to protect the privacy of my patients. I told her that she could come by and then use our computer system and then get information on her own. But of course, I cannot fax the progress note to her or to her school. So always make sure what information you need to get for your clinical time log. So in the end of the clinical rotation, you're not gonna panic. Fifth common mistake nurse practitioner students tend to make is just to show up and not studying beforehand. You are a graduate student and you have to acquire skill to study on your own. After practicing as a nurse practitioner for 10 years, I still learn things on my own. I have to catch up with guideline changes, conditions I never encountered, more complicated cases than I saw before. I constantly have to keep learning, which is a fun part of being a nurse practitioner. But as a student, you have to start acquiring the skill of studying on your own. Of course, you can ask questions to preceptors for things that you can't figure out on your own, or if you want to double check the knowledge you acquire through self-studying was correct or not. But don't show up and say, hey, I don't know everything and teach me everything, because this gives a really bad impression on your preceptors. Remember, clinical rotation is not only for you to learn, but also it's like a job interview. Your preceptors and clinical sites are looking at your work ethic, your personality. And who knows, the preceptor may be able to refer you to your first nurse practitioner job. But if your preceptor have an impression, Miki doesn't prepare, she always just show up and very passive on studying, she might not connect you to the employer. Also, again, it is very important to learn how to study on your own, how to get information that you're looking for. So when I teach nurse practitioner students, I teach them how to use UpToDate and other resources, how to get to the information they're looking for efficiently. But I don't just present, here is the answer to your question, but I rather teach them how to get to the answer, because that skill will last lifetime. I hope this episode was helpful for you. If you have any questions, requests for future episodes, please let me know in the comment section. Also, if you like this episode, please give me a thumbs up And don't forget to subscribe to my channel. I upload episode about nurse practitioner students and new grad nurse practitioners every week. Please make sure to subscribe so you don't miss new episodes. Alright, I'll see you in the next episode. Have a great day. Aloha.